I'm Von Biggs, and let's queer up health. Could Gilead once-a-year HIV prevention shot finally change the future forever? Gilead Sciences announced plans to begin phase 3 testing for a yearly HIV prevention shot. If effective, it could be the closest to an HIV vaccine yet. The drug, lenacapavir, has already shown success as a 6-month HIV prevention option. Gilead aims to file for approval for the 6-month regimen earlier this year. Trials for the once-a-year formulation are set to begin in 2025, targeting a late 2027 for filing. The advancement promises a major step in reducing the global HIV infection rate. Many hope the yearly shot will simplify prevention and change lives in significant ways. You know, I remember reporting this story when it was announced just about the 6-month, but to continue to see the advancements to where we're looking at longer injection solutions, I'm excited to see also where that's going to do for HIV treatment. You know, so I'm hopeful that this, continues to prove that, and that it's handled on both sides versus just prevention.
And I think one of the important things to note is that as much as HIV still remains an issue here in the United States, worldwide, the difference this will make, where it is hard to get clean water in certain parts of the world, where the access to that healthcare is not available. Being able to get a shot once a year, through mobile units, whatever that goes into a town, that's a game changer to keep people healthy and alive. And the same thing would hold true here in underprivileged. If you go down towards, I'm sorry, you can say?
No, you finished. Sorry.
Oh, no, it's okay. You go down to Miami, and they have the IDEA program through the University of Miami, and that works with people that live under the bridges that are forgotten. And they're still sharing needles, and the biggest thing is the transfer of it. And then they give them medication, and then it gets, quote unquote, stolen. And you run into this whole thing, how do you protect it? And how much do you give them? And do they have to keep coming back? This ends all of that by saying, okay, we took care of this for a year, and they can come back in a year.
Access is a good thing that you're bringing up, Glenn, because, this has been a really wonderful breakthrough, and apparently it might cost as little as $40 a year to make this, but the potential cost is going to be $40,000 to $44,000. I don't see health insurers okaying that in the United States. I don't know who's going to actually have access if we don't get this price under control. Now, of course, sometimes insurers start with a very crazy price and it gets more negotiated, but if we don't actually make this an affordable drug, it's going to be really hard to get it.
So I can tell you that, I take 13 pills a night. And one of the pills is over $2,000, and I have to get it refilled every 90 days. So if you take that and you add 1 or 2 of the other drugs I'm on that are just as high, you're at that $44,000 by the end of the year. So you really, in many ways, it's a cost savings. And of course, overseas, it's going to be completely different, just like it was here with all the other HIV drugs. It was unapproachable for a regular person to be able to purchase them. But if you went overseas, they were basically giving them away for free because it was about national security. As countries fall because their leadership gets sick, there's an instability that happens as a result of it. And, we look at it more as an LGBT thing, or at least it was considered that here. But around the rest of the world, when you get into Southern Africa and stuff like that, those were devastated, and, countries fall because leadership dies. It's that simple. This is a game changer.
I just feel like for preventative purposes. So is Medicaid going to provide this where it's cheaper to give them PrEP for a year, even though it's much harder to get them to take PrEP because it's a daily pill? Do you think that they're going to spend the $40,000 on this, or would they do? I think PrEP is what?
I think if you look at the cost of putting someone in the hospital, and Von, you probably could speak to this. What it costs to spend a weekend in the hospital. If this is a much cheaper, long end game.
Didn't Biden pass a law though? For a lower rate of medications recently?
But it was on specific drugs.
Oh, okay.
It was if you're diabetic, it capped it at was it $40?
Right, but they did it on, they've done it on PrEP too, because, technically there was only one available that was a generic, and there's people that can't take that. So that law obviously changes that so that there are more options available. And I think when we look at like you talked about, the worldwide view, and you look at the areas in South Africa where, it's a huge issue, people won't, like women or anything like that, where they're doing studies for a lot of these to happen. They'll go get the medication, but guess what? They're throwing it away before they get home because they don't want their husbands or anybody to find out about it.
Stigma.
Now this is an injection and you're done for a year. Yeah.
And you can get it at a Walgreens, so you're not going into something that's marked as an HIV van or into a, HIV service organization.
Right.
Yeah.
Yep.
So, and just to kind of, to trace, like we started with the AIDS cocktail, and then we eventually got to like daily PrEP. And now there is a once a month shot now, and now a once a year shot looks like it's going to come out. Imagine what we could have done had we been allowed to start that research 20 years before.
Right.
I mean, it's a tragedy that it took us so long.
Yeah. Look how long it took Reagan to act. Like everything snowballs and has a domino effect by everyone's decisions.
Yeah. Well, that is a big LGBTQ story for today. There's no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.